So these things, as you can tell by the name, these scores or guidelines, they're there to guide us for how to approach to the patient. That approach to the patient is a very important first step, because we're going to get a lot of information from the patient, a lot of lab results, a lot of imaging, but we're going to try to see how we utilize them. So that scores or those guidelines help us take the first step. Okay, so it kind of narrows the diagnosis and give us a good initial approach to the patient. But it's very important, when we use these scores or guidelines for some period of time and apply it to enough number of patients, then our view to medicine and view to how we see the patients is gonna change a little bit. So I think these are very important. So the other important thing to use these criterias are, and I remember when I was a resident, Dr. Vasudevan was always saying that. I remember when ICU rounding with Dr. Vasudevan, I was second year resident, and Dr. Vasudevan was always saying that these scores should always be correlated with the patient's clinical setting. Okay, like for example, you may say that I have a curve 65-0 for a patient, and I want to discharge the patient, but the patient, when you see the patient is like tachypneic, and the patient cannot breathe comfortably. But all those 5 scores that you ask, the answer to all of them are no. But you can't discharge the patient because the patient coming for pneumonia and they cannot breathe comfortably. So all of those scores and criteria should be adjusted clinically to be able to be validated and to be used properly.